This is how I like to think about studying for anything, right? Let's say I'm trying to study for exam, study for the NCLEX. This is how I like to think about it. I want you to pay attention to me. Now, let us say we have like two bottle. I'm just trying to draw something, right? This is bottle one, and then we have bottle two, right? This is my concept, how I think about it, right? So this bottle is filled up with fluid. Let's say it has water in it, right? Now, guess what? I want to remove the fluid from here. I want to put it here, but I want to have the same amount, right, of fluid, meaning I need to get it like to this level as well too. Now, there are two ways I can do it. I can directly turn it over, right, to this other bottle, or I can get what? A funnel that will make me turn it over as well too, right? There are two ways. Either I do it directly or I get a funnel, right? Now, the problem with doing it directly is that you might make mistake and lose some certain amount of this fluid right here. Right, you might not
Mhm.
get the exact amount because you might make mistake. Some might go in to the bottle, some might not go in. Right, but if you use a funnel, right, you are 100% guaranteed that everything is going to go in into this bottle. Now, that's the way two different students always used to study. That's what separates students who try to study the smart way from students who try to study the hard way. Right. This empty bottle that I had here previously is just like someone's brain that is empty of information at that moment. You want to learn something you don't know it. The brain is empty of that information. Now, this bottle that is filled with fluid is just like your the area you are trying to get information from. A lot of students get information from various area. Some people watch YouTube videos, some people read book, right? Some people get PDF, right? Some people get audio, right? All these things we are trying to like convert all these things to what? The empty brain that don't have those information. Right. Now, the problem right now is what are you using to connect the information? Right? That's the problem. Is you can easily try to get the information in, but what are you using to connect the information that it's 100% guaranteed that you are going to retain this information, you are going to understand the information, it's not going to be a struggle for you. That's the difference, right? Now, one thing everybody needs is that perfect funnel that is going to get the information in a way that you are not lost of any information, you understand it fully, right? Because you'll be shocked if you transfer the fluid directly. If we have like maybe 180 mil of fluid right here, maybe at the end of the day, you might find that you have 150 and you'll be wondering where's the 30 mil, right? Because obviously some went in, some did not. But if you use the funnel, everything is going to go in. So how do you like bring information to your brain in a way that you understand something so well? Now you need to have the right funnel. Now, funnel is just like uh funnel. When I teach students, right, I look at the funnel just like you see your funnel right here. So I convert it to something like a triangle. If there's three things that we can start thinking of related to anything we want to study that give us 50% of that particular thing we want to study, then let's go for it. The remaining 50% can come later. Let's focus on the first 50% that give us that perfect understanding. So anytime I want to study anything, I like to think about it like a triangle. Like now, if I want to talk about advanced directive now, which I want to talk about. The reason I'm telling you this is because I want to give you the ability to self-study yourself. Because it's not until somebody, because most time when someone explains something, you are like, wow, this person explained this so good. I understand it. But there's a secret behind that person explaining it so good. If you can decide, right, the one you want. If you can learn just one thing that give you the ability to know thousand things, right? Or you just want to sit and wait for somebody to give you thousand thing every time. Guess what? The guarantee of that person giving you that thing every time is not really sure. But that one thing that you will learn and that give you the ability to learn a lot of things, that is more better, because instead of waiting for that person, you are your self-understanding. Now you don't even need to start waiting or relying on that person. Now it's now yourself that you rely on to get the information. So I like to help students to know how to study, right? Anytime you want to study, there are three things that start making sense when you want to study. There's no content that is difficult. It's just that you don't know the way to study for it. I learned this from somebody, right? Now, one, every time you want to study something, right, you need to understand what you are studying that particular thing for, related to what. Like, this is nursing. Anything you want to learn in nursing, always ask yourself, why is this thing important to me as a nurse? The moment you hype your brain out in realizing the importance of what you are doing, trust me, your brain will stick to the information. Now, this is how the brain works. The brain understands it's important of working. That's the reason why the brain, when it's under stress, it always used to scream for help very fast. The brain control, as I'm talking to you right now, the brain is the one that's helping me to make this communication, right? Everything that's going on in the body, they are like more than 80% of things controlled by the brain in the body, right? If my brain stop right now, a lot of things will stop as well too. So the brain is very powerful. So now, how would you learn something in a way that your brain will start realizing it need that information to survive? That's what I want to show you. One, you need to understand what you are reading related to what you want to do. Like, don't just go straight to start reading about advanced directive. The first thing is initiate your brain in the process. Most of the time our body is telling us to read, but our brain is not interested in reading, because our brain can even read us better than we can read ourselves, in a sense that our brain understands that you are stressed, just go and relax. And you will struggle not to relax, but your brain have those bad signal that is already creating a moment for you to relax. That's why you feel tired, you feel overwhelmed with what you are studying. I have never felt overwhelmed with studying when I knew how to study. Like, and I became so addicted to studying that I felt like I am already going crazy about studying. Previously, before, I don't like reading textbook. Now I can read a whole textbook in one day because I have the ability to understand. So when I'm reading a new textbook, despite the fact I've not gone through that textbook before, all my way of reading that textbook, or when I'm reading a textbook, I always used to say, yes, I understand this. Yes, this is what I'm thinking. Yes, not that I've gone through that textbook before, but I have created one key understanding first, which is understanding one, that topic and why it's important to what I'm using it for. Like anything you want to study, always ask yourself, why is this thing important? Right? You might not know why it's important. That's why you have Google right there. You have Chat GPT right there that can give you this perfect understanding. Right? That can give you this perfect understanding, and then you are like, okay, advanced directive. What's the meaning of advanced directive? And then you are like, okay, advanced directive is a document um created by somebody, right? And will be used only when the person, right, is unable to like communicate their need, right? Advanced directive is a document created by someone who states what they want or what they don't want when they're unable to what communicate their needs, right? Or involve in their care. Now you have this understanding. So tomorrow night, if somebody asks you about advanced directive, you can easily tell them, right? You don't need to cram this. You are just trying to just understand why you need this to do something. You need to tie your brain to a particular problem and force your brain to be the solution to that problem. Nobody will tell you to run when you hear a gunshot close to you. Nobody will tell you to run. You just run automatically. That is a quick response from the brain. Now, what are you creating that look like a gunshot to your brain that your brain feels is a problem and instantly give you the solution? That is how you study. That's what separates people from cramming and people that just know it without not cramming. You will ask them, how do you manage to know? They say, I just know it. Why? Is because they tie it to a particular problem. They tell their brain, I need this information in order to pass the NCLEX exam. So the brain is thinking passing the NCLEX exam, and the solution to passing the NCLEX exam is retaining the information for you. So that way, you will 100% all the time retain the information. All you are left to do is just repetition. Keep reading it over and over again. Like I said, advanced directive, right, is a document. It can either be a written document or a person assigned, right, to one care when they are that states what they need, what they don't need, when they're unable to make decision for themselves, when they are incompetent. So that's the definition. So it makes sense that way. So now everything that you should start thinking now should be related to nursing after that definition. So why is what is advanced directive related to nursing, and why is it important for me as a nurse to know about it? Right. Because there are two things when it comes to nursing, right? The two things when it comes to nursing is you, the nurse, and the client. So anything you are trying to learn in nursing, you must learn it related to yourself and related to the client. Now, why do I need to treat a client who have hypertension? Why is it important to treat a client who have hypertension? And why is it that a client needs to be treated related to hypertension? That way, you are not thinking in just one direction, you are thinking in double direction. That way, you will understand the client, you will understand your role as well too. So you will not be tricked when the NCLEX is testing you related to your role or related to the client problem. You will never be tricked. Right. So always ask yourself, so this advanced directive now, how is it important to you as a nurse? Why do you need to know it? And why is it important to the client as well too? So everything will start making sense. You will start learning from your own direction and from the client direction as well too. Right. Now, in nursing, right, in order to study smart, always know that there's a unique process. This process has been available for years, right, which is a process that we call it a systematic process. We call it the nursing process. It's used for everything in nursing. It's always used to be your assessment, right, your diagnosis, your planning, your intervention, your evaluation. Diagnosis don't mean you are diagnosing physiological problem all the time. Sometimes it might just be knowing that there's conflict, right? Conflict is not a physiological problem. It's just like a situation between two people, right? It can be like a diagnosis, right? Assessing is just seeing two people, they are arguing uh on the hallway, and then you start to assess the situation, what is going on, what creates an assessment. Now they tell you what is going on, you know the problem, right? You start creating plan in order to fix what is the problem. You implement that particular plan and evaluate to see if these people are not having that conflict again, right? This is how it works. This um thing right here solved the conflict, right? Same way can solve everything in nursing. It's not a unique process to create just physiological problem diagnosis. No, it's a unique process to create anything in nursing. So one, which is your triangle, is to understand what you are reading, right? Know how it's related to you as a nurse and the client. And three, you must follow a unique process, right? Which this is a unique process. So anytime I wish you to study, I think about it like this: is there anything related to assessment based on this particular thing that I need to know? If there's a problem, is there anything related to a problem based on this particular thing I need to know? Is there a plan I need to start thinking of? What are the intervention? There's always intervention to everything we do in nursing, right? And evaluation most of the time, right? So that way I place my reading and I ask myself, so what is advanced directive? Like I said, I mentioned the definition already. Now, once I know the definition, already know why it's related to me as a nurse. Now, if you go find out why is it related to you as a nurse, because you need to respect the client decision, right? And why is it related to the client is because the client need to have the ability to still hold on to involving in their care even when they're unable to communicate, right? Or do things in their best interest. So that's why it's important to the client as well too. Now, what is the process at which you are learning advanced directive? This is the process, right? For anything. You want to start the assessment. Is there any assessment related to this? Then you will find out that, okay, there are some clients that will come to the unit, they don't have advanced directive. And guess what? Advanced directive initiation starts during admission. So that's why you now need to now know if a client have it or not. So the assessment will start by asking the patient, do you have an advanced directive? Right? And assessment can also come in another form, in a sense that a client might just tell you, I am worried about the kind of care I will be getting if I'm unable to communicate my need. Now, that automatically scream one content NCLEX want to test. Now, I repeat, the question stated that a client is worried about the kind of care they will be getting if they are unable to communicate their need. If you are someone like me who is very much used to the NCLEX test plan content, immediately my mind is like, oh, wait a minute. The NCLEX said a patient is worried about the care they will be getting if they are unable to communicate their need. So I have already scanned through the 100 plus content that I know in my head related to the NCLEX test plan. And I'm like, oh, this content is definitely testing me related to advanced directive, because this is already interpreting advanced directive. That's why I'm telling you, the NCLEX cannot trick you if you know the what, if you know the relation, and you know the process. It's always follow these three things. That way you will see anything you are trying to study or anything you are trying to understand on the NCLEX exam is making sense. Like, it looked like you already have like a guide, or somebody is feeding you information about what you need to know, whereas it's something that you've created, just a simple three-way process to understand anything related to the NCLEX exam. Now that way I'm like, oh, this question is definitely related to advanced directive. Now I will be expecting the answers to be related to advanced directive. And for sure, one of the answer was to ask the client, right, if they have uh, an advanced directive. That was one of the answer. Right. So you see, if you understand all these things that I'm telling you, right, or all the content related to this process, you'll be able to understand what the examiner is saying so fast, a way you will not even overthink. Like, you have a way of just going to get the information from your brain and then apply the correct understanding. Right. So that's two ways assessment can happen. A way, one way, you're asking the patient if they have advanced directive, or maybe the NCLEX will give it to you and they will tell you patient is worried about the kind of care they are going to be receiving if they are unable to make decisions for themselves. That's scream advanced directive. All you just need to do, go to the answer, see if there's any answer related to advanced directive. So assessment start first. Now, guess what? There's two things you can expect during assessment. Is it that the patient will tell you they have an advanced directive, or they will tell you they don't have an advanced directive? Now, if the patient, right, have an advanced directive, what would you do? If the patient also say they don't have an advanced directive, what would you do? Right. Now, if a patient don't have an advanced directive, you initiate the process. Initiation of the process starts from educating the patient about what it is, trying to gather the kind of things they like, they want, like their preferences, right? Now, that is what you want to do, right? If they don't have. And then the last part is okay, the last, that's not the last part. Before you get to the last part, in the process of education, getting the preferences, you need to get everybody involved as much as possible. The doctor, the family, the spouse, loved one, anybody that you know you can get involved to reduce what we call conflict, right? Because if you don't get people involved and you've done the process, the chance of having conflict or disagreement, right, is high, or ethical dilemma is high, whereby they will say, oh, I'm not in support of this. I'm not expecting them not to do not resuscitate for the patient. I'm expecting you to do it. This is my son, so do it for my son, something like that. Problem will start happening, right? And we don't want that. So we get everybody involved so that decision is made perfectly. Right. So now the last part is now who is obtaining the advanced directive. You as the nurse started the process, but you are not the one obtaining the advanced directive. It's left for the doctor to obtain it, right? Any form of advanced directive, because we have three type of advanced directive. We have living will, we have durable power of Anthony or healthcare proceed, and then we have do not resuscitate or do not intubate. Right. These are the three form of advance directive. Whichever one, it's the doctor that obtain it alongside with the legal team that will notarize those documents. Right. So the nurse is not involved. So knowing this, now you understand the aspect of assessment. That is not a problem again. Right. Now, the assessment is the one that leads to you knowing if the patient have advanced directive or not, or what's the problem they have. So the diagnosis part has also been covered that way. Now, the planning as well too is, now this patient have the advanced directive. What should we do? The plan is to make sure that um what we communicate this advanced directive to the healthcare team. We document it in the client medical record, right? And also we make sure we advocate. Those are the three things we literally do, right? The more education we give to clients is that they have the right to like revoke or change any information in their advanced directive. Yes, they have the right to get a review or of the information in the advanced directive to see if they still want to retain those things or they want to change it. So those are things, right? You keep like letting them know. Uh, all the time, right? But the three main thing is you want to communicate this advanced directive, you want to document this advanced directive, and you want to keep advocating for it. Right. This is the three main thing related to advanced directive, and these are things that you are implementing. Simple. Right. The whole evaluation process is to be sure that everybody are respecting this client advanced directive. That is the evaluation process. So now this is everything related to advanced directive. Now, so when you see advanced directive right now, any question related to advanced directive, you'll be able to answer it successfully. Most especially, we have three phases in nursing, right? We have three phases in nursing. We have the admission phase, admission, right? Admission is there. There are three phases in nursing. You need to understand because NCLEX used to write question like in all these phases. Admission phase, we have the in care phase, and then we have the discharge phase. Right. Sometimes NCLEX can say a client, I will give you two ways. NCLEX write some certain question. NCLEX can say a client who has hypertension. And NCLEX can say a client, uh, NCLEX cannot say admitted with hypertension. NCLEX can also say new I want to say newly diagnosed. NCLEX can say newly diagnosed with hypertension. You see, the NCLEX have these three different way of writing the question, but everything are still related to what? Hypertension. So in your head, you are like, is it changing anything I need to know about hypertension? Obviously, no. It's not changing anything you need to know about hypertension, but it's changing the kind of care you are giving to that patient at that moment. Now, when you think about somebody that is newly diagnosed with hypertension, NCLEX is more putting you in a sense that, guess what? This patient don't really know about their condition. So we need to try as much as possible to make this patient stable. Then we start teaching them about their condition. A patient that is admitted with hypertension, right? We are trying to like, it's more of like seeing if this patient have any serious problem that we need to get straight into action before we start doing any other thing. Right. That is that. Now, a patient who have hypertension is more of this patient is used to their condition. So let's just see the problem and let's just solve it. Right. Now, during admission, there are some certain care that we always used to offer. Everybody know discharge care. Like discharge care is all about education many of the time. Education many of the time, right? In care can be related to a lot of things, but admission, discharge have their specific kind of care. The moment you understand the kind of care that is involved in admission, if you see your NCLEX question and the question is testing related to admission, if you look at the answer, you will see that it's following the process of admission. Right. If it is discharge as well, if you look at your answer, you see it's following the process of discharge. NCLEX will not tell you in care. This is how you will know the patient is in care, in the sense that they did not tell you it's newly diagnosed, they did not tell you admitted, they do not tell you discharged, they just only tell you as hypertension. Simple as that. Right. So it's general question that you will get in that way. Now, this is the three phase of nursing, right? Guess what? Now, if a patient have advanced directive, they will start from here. So NCLEX can test you a patient who is admitted um right with social condition, right? Now advanced directive show up in this admission phase, whereby you start asking the patient, do they have advanced directive? Now this is the second phase in care. Now we know this patient have advanced directive. What are we doing? One, we are making sure, because during admission we don't know what is in the client advanced directive, right? We only know the patient have advanced directive. But the moment we are trying to care for this client, we already know the content in the client advanced directive. So when the NCLEX is telling you a patient is newly admitted, you don't really know anything about that patient. You don't know anything about the patient. If they tell you a patient is newly admitted with hypertension, you don't know anything about that patient. You need to read furthermore the question to start understanding, okay, what is wrong with this patient? Because during admission, we don't know anything. We are looking for what is wrong. In care, we already know what is wrong. We are trying to care for this patient. Discharge patient is fine. We are ready to give them the final education to go home. Simple. Right. So now when the NCLEX use admission, like we should start thinking we don't really know so much about this patient. Let us see what's going on. So when the NCLEX say patient is admitted, right, and have advanced directive, trust me, we don't know what is on that advanced directive. So if one of the answer is telling you to initiate emergency care or stop emergency care, or a particular emergency care will not be given, where are we getting that information from? Because this patient is just admitted, we don't know what is on the advanced directive, because this patient is not in the in care phase. So there's no how we can know what is on that advanced directive. Right. So if the patient is not newly admitted, the patient have been on the unit, is an in-care kind of patient currently, trust me, we know what is on the advanced directive, because the NCLEX will even state it. A patient who have advanced directive that states so and so, this is what we need to do. Right. So that is how the NCLEX work. Right. So yeah, I'm just putting it out there. So you need to understand, is are we currently in a phase that involve general care, or are we in a phase that, okay, we need to do something? Now let me show you some certain question right now. Now if you look at this question, if you look at right here, it's saying admission. Can you see my screen?
Yes.
All right, you can see this question is saying admission. You see, the nurse is assisting with the admission of a client who is scheduled for colon resection. Right now, it's going to start making sense, in a sense that what you are doing right here, you are only doing the assist. You are doing as you are assisting, right, a nurse, right, during admission, because obviously this is a PN question. So it's more of you assisting the registered nurse most of the time in most tasks that you don't really have that full scope of practice to carry it out on your own, right? So that's why the NCLEX is writing the question like this. The nurse is assisting with, right, the admission of a client, right, scheduled for colon resection. Now what are you doing right here? You are assisting with the admission. Obviously, admission, who does the admission? The registered nurse. Is not the scope of practice um of the PN. Now, what me I'm seeing right here in this question, if you are seeing same thing that I am saying, right? What I am seeing right here is, one, we have you, the nurse, right? And you are assisting with the admission, because this is the tax. Every time you are answering a particular question, always know your tax, right? It might not be you in that question, it might be anybody. I wish you to tell students the hospital setting is full of a lot of people. The same way doctors are writing their exam to work in that hospital, the same way nurses are trying to pass the NCLEX exam as well to work in that hospital. The same way pharmacists as well are trying to pass the exam to work in that hospital. So we are a lot in that unit. But always remember that the NCLEX is testing you related to being a nurse. So don't be distracted with a lot of things you are saying. Just pay attention to the people in that particular question. That's why the body of the question is very important. Right. Here we have the nurse, right? The tax is during admission, or the phase is during admission. We also have the client, and we have what they are doing. Right. So if you are anything like me, immediately I'm thinking, okay, yes, I'm the nurse here. I'm the one doing the assistant. What I'm doing is related to admission. So I'm going to lock this in as my own thing. Right. A client who is scheduled with colon recession. Colon recession is not within your scope of practice. That is the scope of practice of the healthcare provider. That's not your scope of practice. But guess what? The NCLEX cannot just say you are doing an assistant during admission. NCLEX believe that you already know the kind of assistant you are doing when a particular medical doctor procedure is about to be done. Like in nursing, there's a lot of procedure that will be done by the healthcare provider, but at the end of the day, there are things you do. It's just like preparing for intubation. You are not going to intubate the client, but you prepare for it, right? There are a lot of things as well too that you do, but you just do the preparation, but you don't actually do it. Same thing with when a patient is going for surgery. Now, the moment you understand that this is a surgical condition, right, the next thing in mind is you are thinking about what are you doing to assist the healthcare provider in this process, right? We do three things. We do pre-operative care, we do post-operative care, and we also monitor for what? Complications. Right, this is your scope of practice related to any client that is going for surgery. I've told many students this, right, over the last 2 years that I've helped 700 students pass the exam. NCLEX will not test you related to surgery. NCLEX will give you the name of the surgery, but indirectly NCLEX is not testing you related to surgery. Is any of these three things that the NCLEX is testing you? Right, NCLEX know fully well that surgery is not within your scope of practice, but doing preoperative care is within your scope of practice, doing postoperative care is within your scope of practice, and monitoring for complication is within your scope of practice. You need to understand complication. You don't need to start reading different surgical conditions to know complication. Complication is very clear. The ability to know that a patient is dying or a patient is not doing fine, every nurse should have this. And how can you know this? That is when you understand how the body system work. The reason why many students rely on reading many surgical conditions to know the in and out of that surgical condition is because they don't even know how the body system work. The body system is the one that give all this problem when being affected. So the moment you understand how the body system work, you will instantly start knowing complication even when you don't know anything about that particular thing that you are being tested on. I don't need anybody to tell me that after a patient have a particular heart surgery, I need to check for pulse. Pulse is important because the heart surgery in my head, I'm like, oh, this is a cardiovascular procedure. Definitely something can be wrong with the pulse, so I need to check it. Even if I've not read about that surgical procedure, it makes sense that this is a cardiovascular procedure. Pulse can be something that will be important. But a lot of students, if they have not opened their book in order to read about heart surgery and to see that pulse is something they need to check, they will not even believe in the answer. Why are they not believing in the answer? Because they don't even understand how the body system work and what can be affected when a particular procedure is being done. Like if I don't know what kind of procedure they will do on the lungs, but I can tell you a lot of problem that can happen after a procedure is done on the lungs that I need to watch out for. Not because I know this procedure, but because I know what can be affected in the lungs. It's just like right now, if you have a phone, right? Let me clean this. It's just like right now, if you have a phone and the phone is bad, but let us say it's the speaker that is the problem. But before the phone repairer is going to fix the speaker of the phone, guess what? It's going to remove some other things as well too, right? It will remove a lot of things in order to get to the speaker of the phone. Now, in the process of removing other things, do you know that the phone repairer can damage other things before even getting to the speaker unknowingly to the phone repairer? And then when you get the phone back, yes, your speaker is now working, but guess what? Another problem has been caused. Then you will now start saying, oh, when I gave you my phone, this particular thing was working fine, but now it's not working. That is how surgery is as well too. That's the main reason why we monitor for complication. But how would you know that particular thing is not working fine when you don't even understand that particular body system? Let it make sense. That's the reason why the first thing you need to know, which is your foundational knowledge in nursing, is to understand how the body system works. So how does the body system work? That is the body that how does the body work? That is through the body system. Now, what are those body systems? You need to know everything. The moment you know everything, you know the use of each, you know the structure, then everything start making sense. So now when the NCLEX is testing colon recession, if this question is related to complication, I already know the kind of complication I need to expect because colon is related to the GI. So I'll start thinking about GI complication. I don't need to know about colon recession before I know all these things. That's why I wish to say a lot of students have two ways to fill up information in their brain, but they go with the difficult way, right? Because they don't see a easy part in connecting information. That's why I help fill in that gap to make sure that every information is clear when students are trying to study. Now, the problem right now is the ability to get that information in. Yes, you can have two bottles, as I said, you want to fill in the water that is here into this, right? And you need to like maybe get a funnel to make life easier for you. But now the problem is when students don't have access to this funnel, they just say, I can't stress myself. Let me just try to be filling it in the way I can. Right. But they meet with problem. If only they can be patient with themselves to go get a funnel to fill it in, they just only need to do something once and it give them solution for life. But the problem with many students is getting the funnel. Right. They don't care about how they want to study. They just care about let me just see how this thing can work out for me. The moment you keep trying, let me see how this can work out for me, you will waste a lot of time. You might not likely succeed in the process, and it's going to be a lot of stress on your end. But the moment you follow the right way, right, it will stay forever with you, and then you have the ability to succeed at anything you want to do. Right. So when I see this particular question is related to admission, I easily know that this question is testing what I need to do before this. Right. This is one process. This is one process. Right. So it's telling me what do I need to do before this? What am I assisting during admission because of this particular kind of care this client want to receive? So one, this particular care is not within my scope of practice, but what is within my scope of practice? Because I'm thinking about admission, because anytime you are thinking about surgery, the three things that should come to your mind should be pre-op care, post-op care, and monitoring for complication. That's the three things. But guess what? We cannot do these three things at a time. We need to do one after the other based on the situation we are currently. Guess what? The situation we are currently is during admission. So which one would you do during admission? I want you to answer this question. Do you do pre-op during admission, post-op during admission, or monitoring for complication during admission? Tell me.
During admission, I think you should do pre-op care.
Okay, great. That's correct. We do pre-op care during admission. So it means that all this question now is related to pre-op. So the moment you got it right here, every other thing will make sense. Now, the only time that you will get this question wrong is if you've not studied about preoperative care. Right now, we need to now understand what the question is saying. The question is saying which of the following statements made by the client will be most important for the nurse to clarify. So meaning we are trying to look for something. There's difference between clarification. Okay, let me just always explain clarification. Now, clarify means you want to be sure about that particular thing. You are thinking about something, but you want to be sure it's not that thing, or maybe it's that thing that you are thinking of. That is about clarification. Right. So there are a lot of things we do related to pre-op. All you just need to do is to spot those particular things, right? That you do. A lot of people, coaches, tutor have taught pre-op, but they don't follow this triangle principle that I said that give you the ability to answer any question successfully. The thing when it comes to surgery, one, I've clarified the fact that you don't need to know. You can pay attention to the surgery to some certain extent, but the surgery is not the main thing because NCLEX is testing related to pre-op, post-op complications. So I've given you that clue that you don't need the surgery, you need your own scope of practice, which is these three things. So now your mindset is these three things, your focus is these three things. Now, next thing you are thinking about is what is related to pre-op, what is related to post-op, what is related to complication. Now, many students will jump straight into reading it, but I don't encourage students to jump straight into reading it. Instead, understand why pre-op, why do you do pre-op care, right? Why is it important for you as the nurse? Why is it important for the client, right? Same thing with post-op, same thing with complication, right? Pre-op care is a particular care that we do, right, in order to reduce the risk of complication during surgery. Now it makes sense. Now in your head, you are not like, oh, okay. So pre-op care is something we do in order to reduce the risk of complication during surgery. Now your brain is waiting to know those list of things that we do. Right. I don't want to waste much of our time, but let's focus on what we have right here. And I'm going to explain all these things related to pre-op. Now, see the first answer. The first answer is saying, I have urinary incontinence when I sneeze. Now, many students will not understand that answer because they don't understand the principle of pre-op. Now, let me tell you something now. There are conditions, as a nurse, right? We always used to watch out for some certain condition, right?
Mhm.
These are conditions that we always used to ask ourselves that if a patient have this kind of condition, we need to clarify this kind of condition because it can be dangerous during surgery. Right. Now, those conditions are related to this: airway condition, breathing condition, circulation condition. Now, when I'm reading option 1, it's related to condition. It's talking about urinary incontinence when I sneeze. So it's related to a particular condition. So I'm going to ask myself, is this airway condition? Is this breathing condition? Is this circulation condition? No.
No.
So, and in during pre-op, we only want to clarify condition related to airway, breathing, circulation. So no matter how I see this as a problem, because it's not related to these 3 conditions that can be causing problem during surgery, I'm just going to X this out. So I don't need to think about it. But guess what? I've been coaching for the past 2 years, 700 students. Many of these students will say, oh, coach, I was thinking because of this patient said they have urinary incontinence when they sneeze. Maybe that's why it will be the answer. They always think about it because they don't know the clear way of thinking about that information. That is what is missing. And now I've solved that problem now by telling you when it comes to a condition, the only thing you are thinking about related to a problem that can occur during surgery is airway, breathing, circulation, and this is not related to that. So out. Right. There are many things I can explain about it, but let's just leave it like that because one thing you need to know is the aspect because let me add it so that it make more sense to you. You see, the NCLEX said I have urinary incontinence when I sneeze. Now, guess what? A patient is having colon recession. They are going to be on general anesthesia. So how will they be able to sneeze during the surgery? Right. So
Mhm.
if they only have the incontinence when they sneeze, so if they cannot sneeze during the surgery, so how would they have the incontinence anyway? So they will not be able to sneeze because they're going to be on general anesthesia. There are many ways to think about it, but I don't just want to like go deeper. I just want to like just stick to the surface level that even a grade 5 student can easily understand. Now, 2 is I had successful cataract surgery 2 years ago. Now, during preoperative care, we always used to ask this question: have you had any surgery before? Now, the patient is like, no. Then if they say no, then fine, we move on. But if they say yes, guess what? We want to know how the previous surgery was. Was it successful? Was it unsuccessful? If it was unsuccessful, we need to let the doctor know about things that happened during that surgery. But guess what? This patient is saying the surgery was successful, so there's no need to clarify here. So this is out as well too. Right. So, but a lot of my students previously, before when they join my coaching program, they are like, oh, this surgery is 2 years. Maybe there's something I need to clarify. Oh, it's a cataract surgery. Maybe the cataract is a problem to the colon recession. You see all this thinking. I don't know where they are thinking about it from, but guess what? They are thinking about it. But I was able to change their way of thinking. Now they now know the way they are thinking, it's even out of the question. They should not even be thinking like this in the first place. So this is how I help students to connect the content, because you see what I said previously before. I said there are 3 ways that you can pass the NCLEX exam. Very important that a lot of students will fail the exam. One of these things is why they fail. I call it the CWU, right? Content, right, understand. You see, you can know that this question is related to preoperative, but can you interpret the writing style, the same way I'm interpreting it, that it make more sense. That is knowing how the examiner writes the question. The moment you can know how the examiner writes the question, we can all have that same understanding together. Right. So now the third one, which is I take acetaminophen for occasional headache, right? Which means you are what? Trying to like you are taking this particular medication, right, for a particular problem, but what the NCLEX is really trying to test here is related to the kind of medication you use before surgery, right? Because there are some certain medication you use before surgery that can be a problem. And anytime I always used to ask students, mention that particular medication you feel is going to be a problem before surgery. Many students will mention anticoagulant, antiplatelet. Yes, because these are medication that can cause risk for bleeding, right? So, but one thing I always used to tell students is you want to only know those medications that they are not a problem towards surgery, and leave those other ones that are problem, because the ones that are problem are a lot, but the ones that are not a problem are few. So if you can know the few, guess what? Even if NCLEX don't give you even if NCLEX, how do I say it? Like, it's just like we know the good ones already. Now, if we look at the medication NCLEX gives to us and it's not related to the good one we know, automatically we know it's the bad one. Now, let me list the 3 good medication you can give before surgery, right? You can give acetaminophen, which is 1. You can give antibiotics, which is 2. You can give pain medication as well too, but not NSAID, aspirin, all those kind of things like that. Right. But you can give pain medication, antibiotics, and right, acetaminophen. So these are the 3 good medication. Now, NCLEX said acetaminophen, right? And remember, I said we always used to do medication reconciliation. This is where we try to see the kind of medication the patient is using before surgery, right? To make sure it's not the bad ones that they should not be using that they are using, right? Common ones like your NSAID, aspirin, antiplatelet, anticoagulant. Yeah. So yeah, so we know that. So since this is acetaminophen, this is a good medication and it's not a problem during surgery, so that is out. Now I left with one answer, which definitely is our answer. I usually have a few glass of wine in the evening. Right. Why is the NCLEX putting this answer? Because we don't want a client to take alcohol or smoke before surgery, because this can be a problem towards the surgery. But this is related to wine. This is not related to smoking. So let's think about the wine part. Most wine have what? Alcohol in it. So that's the reason why the nurse wants to be sure by clarifying if the content of this wine is alcoholic, and if so, then I don't think the surgery is going to hold, right? So you can see why the answer is number 4, right? True of us.
So true, but I didn't even think about the wine part. I was thinking about fasting 8 to 12 hours before the surgery. That's why I didn't think about the alcohol part.
Yeah, yeah. But there's one thing that give you the time. NCLEX is very smart. NCLEX know that when they talk about drinking, you might likely be thinking about the drinking nothing by mouth again, or don't take anything after 12 midnight.
Yeah.
NCLEX know you might be thinking about that. But NCLEX, they are very smart. Instead of giving you a time that interprets after midnight, they gave you
They put
evening.
evening.
So evening is before midnight. So all the thinking of maybe they have had something to drink in the morning or something like that has been ruled out. So now it's the whole focus is if this glass of wine is related to alcohol. Right.
Hmm.
It's just like maybe the client, because the client now stated, I usually have few glass of wine. They said, I usually, they are not even telling you they have that glass of wine, maybe in the morning or something like that. They will say, I usually have a few glass of wine in the evening. But if it's in the morning, I would say, oh, you are here for your surgery and you have something in the morning. We should not even have you on anything like no food, no drinking before the surgery. But this evening has ruled out that thinking. So it's more of the wine, which is related to alcohol. Right. You
Hmm.
see, this is a smart way of thinking when it comes to understanding. And if you have any other question related to pre-op, It's still the same way of thinking. You don't need to do 1,000 reading in order to answer 1,000 questions. You need one reading to answer 1,000 questions. So that is it. Now, the last thing we are going to do is related to advanced directive. I want to see you answering this question. So this is the last thing we are going to do. So read this question and answer it.
Okay. The nurse is the nurse in the rehabilitation facility is admitting a client who had a stroke. The client has an advance directive. Which of the following actions should the nurse take? Select out a plan. Retain and do not make the healthcare team. Not notify the given. Client had a stroke. They have an advance. So I will go with one. Obtain a do not resuscitate order for the client if it's already an advance directive. No, I'll go with two. Make the healthcare team aware of the advance directive. And five, document the medical record that the client has an advance directive. So 2 and 5 for sure. When is the client? Send the film. Have another one. By the client. I'll say 2 and 5 for sure.
Okay, so let's try by understanding the question, right? So the nurse in a rehabilitation facility. Now, they told us about the nurse and they told us about the settings. That's what we know for now. Is admitting. Now, they gave us the phase. This is during what? Admission of a client who have stroke. So they gave us the condition, right? Guess what? The condition is not as important as the pace at which we are carrying out the care. We are carrying out admission care towards a client who have stroke. Now, the NCLEX did not stop here. Instead, they said the client has an advanced directive. It means that during this phase, the only information the nurse required for was if this client what have an advanced directive, and then the answer is yes, the client has an advanced directive. So it means that the NCLEX wants you to focus on the advanced directive more than even the stroke. Now, how would you be able to evaluate if that is true? Just go and read your answer keys. You will find out that there's no answer that is related to the stroke. Instead, all your answers are related to advanced directive. Look at it for sure. Do not resuscitate is advanced directive. Advanced directive is already here in the answer. Emergency care is related to advanced directive. Advanced directive is already here. Advanced directive. Every answer scream advanced directive. It automatically means this question is testing you related to advanced directive. So now bring back everything you know about advanced directive. But let's start by understanding what the question is saying. Say, which of the following action should the nurse take? So we are looking for the action the nurse should take related to a client who have advanced directive. The first two answers that wishes to, three answers that wishes to come to mind is one, communicate, document, advocate for the advanced directive. So I'm going to ask myself, do we have advocating right here? Right. We have something like notify the client that
Hold on, you said communicate. I'm sorry, you said communicate.
Communicate, document, and advocate. You got that right? All right. So one, I want to look for, and communication and documentation is always during admission, right? Advocating is during in care. Right. So during admission is what we are being tested on, not during in care. So NCLEX will not put answer related to in care right here. Now look at this answer. It's saying notify the client family that emergency care will not be given. Now guess what? Do we know what is on the advanced directive? No. Because it's not stating the kind of emergency care the client don't want. So why should I notify the family member that emergency care will not be given out? We are looking for communication documentation answer related to admission. Right. This is communication right here. This is documentation right here. So 2 and 5 is definitely correct. We don't notarize as a nurse, right? That is the duty of what? The legal team, right? And we don't obtain advanced directive. That is the duty of who? The healthcare provider. So that is out. You almost said your answer is number one. Why?
I had I was reading too quick and it said obtain, and I thought it said had obtained. So when I realized that it said obtain, that's why I switched it to just 2 and 5 because we don't obtain it. So I read it wrong, reading fast. So that's why I said
Mm.
nope, never mind about number one, 2 and 5 for sure.
Yeah, yeah. So yeah, the answer is 2 and 5, right?
Yay!
The answer is 2 and 5. So yeah, that is how you think about it. So what I want you to do for me is, yeah, the process of studying is not difficult, right? So what I want you to do for me is go to the NCLEX test plan,
Mhm.
right? This is the information I just taught you, advanced directive, right? So try as much as possible to learn or understand what other content mean as well too. What does it mean to
Okay.
advocate for client right and need, and what are their right and their needs, right? What does it mean to promote client self advocacy, and what are those things we promote, right? So that's what NCLEX test. What is involved in assigning care? This is your delegation, right? Why do we involve clients in care decision making, and why is it important? All these things, you just need to know them. Once you know them, you have a strong base knowledge related to all this information right here. Now, when the NCLEX will be testing you related to anything, you will easily see and spot those things. You saw how I was able to spot that, oh, this question is related to advanced directive, and I was able to spot the other one that is related to preoperative care. You as well too. You were even the one that said it, because I just gave you the hint and you were able to understand that yes, this is definitely preoperative care. That is the same way you can be able to spot any information on the NCLEX question. The moment you can have this ability to spot anything like that, it give you 75% chance of having that question correctly, even when you don't understand what the question is testing or the answer.
Mhm.
Let me just say the answer, right? So, but at the end of the day, if you now master the content, then you should have your 99.99% accuracy in selecting the correct answer. So that is how it pretty much works. Any question before I go?
No, I'm so now when I study for the next 2 days, I'll be studying coordinate care and trying to do questions based on coordinate care.
Yes, yes.
So when is our next class?
I will let you know before the end of today.
Okay, perfect,
All right.
perfect.
So another thing I want you to do, you have this question bank document, right?
Yes, you sent it to me. I have to send it to my iPad because it's only on my phone. So let me do that now
Okay.
while
So I
we're
want you to
talking.
I want you to answer, you see, from this question 2 all the way to, I want you to answer the question 2 all the way to this question 10. Right.
So
You
what
see it
number?
right there, item 10.
Okay, item 10 to what number?
Yes.
Two.
From item 2 to item 10.
Okay, item two.
Right.
Okay,
Item 2 to item 10. So I want you to do that. Right. And like send the answers to me today.
okay. It'll have to be once I get off of work.
Yeah, no
I'll try
problem.
to,
Anytime.
yeah. Okay,
All right. Take care of yourself. Bye bye.
okay, thank you.